Hello, everyone. Welcome to the Women's Health and Fertility Podcast. My name is Dr. Tina Yang, and I am so excited for my next guest. She is a dear friend of mine and a sister in the fertility community. Her name is Dr. Miranda Naylor, and she is a board certified functional medicine doctor specializing in women's reproductive health, hormones, and fertility. She is passionate about empowering women with the knowledge and tools to take control of their health at every stage of life. Dr. Naylor experienced firsthand how the conventional medical model was failing women. She spent years uncovering her own health factors leading to infertility and ultimately was able to conceive two healthy boys naturally, to the surprise of her fertility specialists. This ignited her passion to bring functional medicine to women seeking optimal health. She believes that all women deserve personalized solutions for their health concerns. She is passionate about educating and empowering her patients so that they feel confident on their health journey. Dr. Naylor supports women with PMS, painful and heavy periods, thyroid dysfunction, perimenopause, and menopause. She helps women with PCOS and hypothalamic amenorrhea heal underlying factors and restore healthy menstrual cycles. She also works with couples to optimize their preconception health and fertility to improve their chances of having healthy, thriving babies. Dr. Naylor is also the host of the Modern Women's Wellness Podcast, your go to space for science backed insights, expert interviews, and real actionable strategies to help you take charge of your hormones, fertility, and overall well being naturally. Well, I am so excited to introduce my next guest, Dr. Miranda Naylor. Thank you so much for joining me today for this interview. We have such an interesting history together, and I'm just feel so lucky and like I'm just so looking forward to interviewing you and learning more about how your practice has evolved over the last few years. So I'd love to just start by asking you a little bit about your background and how you got started with functional medicine for women's health and fertility.
Yeah. Well, yeah, my story started back when I was in residency for family medicine. I was trying to get pregnant. I came off birth control and was like, "Oh, this is a perfect time to start a family when I'm most stressed in my life," and didn't get a period
Right.
back, as you know. And this was my first big aha moment into, wow, conventional medicine really doesn't have a lot of answers for women when they're struggling with women's health issues, for really anything that is, menstrual cycle related, hormonally related, there are so few solutions. And I realized this personally where I was like, wow, I'm really dissatisfied with feeling like I don't know. I just have to wait and see. And there really isn't anything more that I can do. I was really curious why something seemed to not be working correctly in my body. And again, there wasn't really that curiosity. So that was my first, insight into this. And I learned about functional medicine at that time and was like, wow, this makes a lot of sense that it's really designed to ask those questions of why is this not working? What can we do to really optimize our body's functioning? And that really just clicked with me. So I've been on that train since. It's like opening the box or taking the pill, sort of speak, of like, I just can't unsee this. And I've just, been in love with it since then.
That's amazing. And it's so interesting to me how, well, first, I just have to commend you for being ready to enter motherhood after such a rigorous training of medical school and being like, I'm ready to start a family. And I think I see a lot of women in that situation where, we put so much into our education and our career that our, adrenals can be a little bit tapped out, I think, in the process of achieving all those amazing things in our lives that when we're ready to start a family, it's like our body needs to sort of recalibrate again, which it kind of sounds like which was what you were experiencing for yourself. But that's just, it's so cool that you looked back at everything and you reflected and said, there's got to be more to this
Yeah.
than what conventional medicine's offering.
Yeah, I think I was a little naive at the time where I was like, oh, I'm 30. This is a great time. I've got great medical insurance right now. It was like, for some reason, that was sort of the deciding factor. I'd been with my husband for a long time already, and
Hmm.
we're like, this is a great time. And now looking back, I'm like, that was ridiculous to try to take on pregnancy and motherhood in the like craziest time of my life. So looking back, I'm really grateful for my journey for a lot of reasons.
Hmm.
It taught me
Hmm.
so much. But yeah, I feel very grateful that I did have that insight. And I wasn't just satisfied with not knowing what was going on and just, oh, okay, sure, yeah, I'll just keep waiting. I really had that instinct inside of, wait, this doesn't make sense to me though. Like, why would
Hmm.
something stop my period? This is something that, should be happening. So, yeah, I was really grateful for that.
Well, I'd love to hear a little bit about what was conventional medicine offering you at that time
Yeah.
to
So
regulate your cycle or to get your period started again.
Yeah. So again, I was in family medicine residency. So first I went to my own knowledge, right? Of like, okay, well, what do we typically do here? Really, there wasn't anything to do right off the bat. I knew, and like it's sort of like I knew that it can take, they say like 3 to 6 months for your period to come back after birth control. But even that, for some reason, once I was in it, I was like, wait, but this still doesn't sit well with me because I feel like I'm just waiting. 6 months is a long time when you're in it.
Hmm.
Just
Hmm.
waiting around for your body to come back online. And I was like, well, isn't there something that I should be able to do? Or is like I kind of just wanted to be proactive and I didn't have any tools. So that's when I went to an OB-GYN and they did some testing and said, oh yeah, your estrogen is really low.
Hmm.
And we can do some progesterone to sort of like trigger your period to come back,
Right.
basically like a challenge, progesterone challenge test. We did that and it failed. And then it was like, well, just keep waiting. It was sort of like, oh, let's try one thing. Oh, that didn't work. Okay, I don't really have any other
What
tools.
does that mean when you fail a progesterone challenge test?
Well, good question. I did not get a period or I didn't get any bleed because it really
I
isn't that
see.
you're getting a period. It's that they're giving you progesterone and then the withdrawal of the progesterone.
Correct. Right, right.
Same with birth control. That's the same reason we get a bleed when we're on
Sure.
hormonal birth control.
Yes.
But even
Thank you
that,
for clarifying that because I
yeah.
think that that's such a common treatment that's used through a lot of like reproductive endocrinologists too for hypothalamic amenorrhea and for PCOS. So the expected results would be that you would be on it for a period of time, right? And then when you stop the progesterone, your period should start in a couple days. Is that correct?
Correct.
Ah,
Yeah.
okay.
Yeah. Yeah. And it basically just tells you, that you have some uterine lining there that is
Yes.
ready to shed with withdrawal
Right.
of
Right.
progesterone. So it did give some information. But again, it was like, again, I had this instinct of this is not really a solution, though. We're doing something that, yeah, maybe in theory it could stimulate things to, come back on track, but it just wasn't doing anything. And then it was,
Hmm.
nothing beyond that we could really do. So yeah.
So what were the next steps that you felt like were logical for you, like as a physician? I'm sure in your brain you were thinking all these things like, okay, these are all my options. What did you think at the time made most sense for you?
Well, started investigating more myself, and again, that's where I may have already heard about functional medicine. I can't remember the exact timing, but started diving more into that. Of okay, what can we actually do to again maybe work with the body more, do something preventative, or I guess in this point it wasn't really preventative, but more proactively. What can I do to then actually support my body in what it needs? I did start going to acupuncture at that time. This is when I was in LA. So before I started coming to see you, but started acupuncture, started having conversations with more holistic providers who were saying things like I was also a vegetarian at the time. I
Hmm.
was so undernourished and overstressed. It's again ridiculous to me at this point looking back, but it was a learning experience to me. Oh, wow, maybe my body does need to eat meat. Maybe I'm
Hmm.
not getting some of the things that it really needs. And I really started to have a shift in my perspective of, okay, it isn't just black and white dogma of conventional medicine that I really had drilled into me throughout medical school and
Hmm.
residency. It was really opening up my eyes to like, I don't have all the answers. And so what other answers are out there? It was a slow process in learning that, especially because I was still busy in residency and everything.
Sure.
but really starting to explore for myself, doing my own research, starting to, go on podcasts and websites and things like that and starting to try things. So yeah.
Well, I think that is just so cool how you were like, okay, I'm going to look at what is outside the conventional model and kind of question it a little bit. And, I'm sure it has shaped your healing journey. And I'm certain that that also shapes the way you practice today in helping your women, when your female patients, and kind of navigating the journey and the hormones and understanding their hormones too and where they're at. Because, I mean, our cycles are different every month. Our hormones ebb and flow. And I feel like there's not a lot of conversation around how that happens and how it's normal. And I feel like oftentimes we think everything's kind of just this like not stagnant, but like there's consistent, flow of your period and your cycle. But we're so much more complicated than that.
Oh,
And right. And so many things affect our hormone levels and how, they change from month to month, depending on what's going on in our lives. So, I'd love for you to talk about how your own healing journey shapes the way you practice and how you help your patients today.
yeah, yeah, it absolutely has shaped the way that I work with people. Again, for one, I mean, at this point now, my journey led me to become certified in functional medicine and primarily practice functional medicine, but I still have my, conventional medicine background too. So even that alone really shapes the way that I work with people. I like to say that I kind of bridge the gap
Hmm.
between, the medicine that we're used to and this other world of really going into holistic medicine, which can feel very foreign to a lot of people if they're not used to it. So I really can kind of like speak to maybe what they're used to or what they're expecting to receive from, a doctor and then be able to, show them this other option. I also have, of course, my personal experiences led into it. For one, even just the patient experience, being on the other side of things and feeling that feeling of, wow, my doctors really don't care as much as I wish they would, or they really don't have the solutions that I
Hmm.
hoped that they would. I was looking to them as like they should have all the answers, and then they didn't. And so I take that into my work with every single patient of like, I know where you're coming from. I know what you've experienced. And luckily there is a better way of working with a doctor and it doesn't have to feel so disheartening. You can really feel heard and seen. And that's one of my goals with every single patient encounter, with every single patient, to make sure that they're feeling completely heard and supported on the journey. So that they're getting the experience that we all deserve.
I love that. And what a perfect combination to be able to integrate, Western medicine and functional medicine. And for those that aren't familiar with functional medicine, would you be able to share a little bit about what functional medicine is and how it differentiates its treatment from like traditional conventional medicine?
I'd love to. Yeah, so functional medicine is basically a science-based modality of looking at health and wellness. And I like to say at the bare root of things, we're trying to get to the root cause of symptoms rather than just put a band-aid on things. I also like to talk about kind of a spectrum of health where, say, there's a middle line of you're okay, the line of fine, we call it, like you're okay, you're not dying, you don't maybe feel great, but you're okay. On one side, you're dead or like just like horrible illness, and that's really where conventional medicine started from. Medicine was created to keep people from being sick. And so that's really where the conventional medical model thrives.
Hmm.
Diagnosing pathology, treating people with medications so that they can come back from being very ill.
Hmm.
But on the flip side of that, beyond the line of fine, it's optimal health. And that's really where functional medicine shines. We can do all of it, like we can work in all of those places, but it's really where it shines to go from you're feeling okay, but nothing, too bad, to really feeling good, to feeling amazing, to having optimal health, and ideally preventing things from coming up in the future, really having everything function as best it can in your body so that preventing some of the illness from coming up later on.
Well, that makes a lot of sense. And why wouldn't everybody want to feel optimal and
Oh,
just feel like the best version of themselves
yeah. I
while
really see it as the future of medicine
hmm
because honestly, again, it's sort of old school to think the best we can do is just not be sick. Most
Right,
people
right.
nowadays, they do a lot. They spend a lot of time
Sure.
and effort to exercise, to eat well, and to do all these things
hmm
to try to feel really good. And again, the medical model is a little bit outdated to just be
Right.
looking at, oh, some basic markers. They all look fine, you're fine. And people are at this point where they're not satisfied with that anymore. So yeah,
Totally.
this should be the norm.
hmm Well, and I think we're also living longer too.
Mhm.
So, we really want to optimize our health through all phases of life and, be able to lift our grandkids and not be in pain and, be as healthy as we possibly can be into the golden years. So I feel like that's sort of the trend too, where, like you said, just skimming by and just being okay has now changed to like, wait a minute, I want to prevent disease and I want to feel as good as I possibly can, move as freely as I can without pain too. So
And I
can you t
way, oh, sorry, I was going to say, I think we've gotten away too from traditional wisdom that, a few generations ago, our grandparents, great grandparents also knew how to take care of themselves better. Maybe they were working on farms, they were active, they weren't driving everywhere.
right.
They ate local foods. They didn't have, all the chemicals and plastics and things like that in their environment. So naturally they had some wisdom around taking care of themselves. And so they didn't need the doctor to do that. And now we have so many things in our environment. Our lifestyles are so different now that we do need some guidance in, okay, how do we get back to taking care of ourselves?
So true.
So,
So true. Well, can you talk a little bit about the ranges, like the lab? You mentioned a little bit about when you're doing laboratory testing, and in conventional Western medicine, the ranges can sometimes be really broad. And so I know that there's like optimal ranges that functional medicine looks at. Can you talk a little bit about that?
love to, yeah. Yeah, so that's a great point to bring up that, a lot of the lab markers, we might look at the same things, but we might look at them in a little different way to, like you said, look for those optimal ranges. Some good examples of this are thyroid markers.
Mhm.
When someone is looking at your thyroid, your regular doctor, you go and they're screening for things. If they're looking at your thyroid, usually they're doing a TSH, which is thyroid stimulating hormone. And it has a very broad range. And
Right.
oftentimes it's not flagged until it's very abnormal. When
hmm
in reality, we know that a lot of the studies that those numbers were based on were not actually very appropriate. And we can have numbers in the normal range, air quotes, that are still like we could still be really not feeling well and we could be having some health issues because of that. So that's one good example. Another example is vitamin D.
Yes.
It can be
Right.
very, very, very low and still called normal, when in reality,
hmm
for that one, I like to see it 50 to 80. We really want to have it in a much higher range than the normal to have optimal health. And there are other ones like this too. Some of the like markers that go along with iron, like ferritin,
Sure.
so many things can really be looked at with a different lens of optimal health rather than again just skimming by or not being.
Right. And I would imagine when you're trying to conceive in that preconception window and when you're actively trying that those ranges may even be a little bit narrower too. S- Right. And so I'm curious to know about what your functional medicine approach is for women that are trying to conceive and what like a typical functional medicine evaluation or experience with you would be like.
Yeah. Yeah. Well, first and foremost, we always have a really long conversation as an sort of like their first intake appointment is, a long one because we're talking about their history, their environment, everything that really brought them to where they are now, rather than just focusing on, one system in the body.
Right.
Like we're not focusing on just their uterus, we're focusing on their entire body, their
hmm
environment, what they're exposed to, and aspects of their daily life, how they're eating, how they're sleeping, how they're moving their bodies, so that we can really put a puzzle together and look at those pieces that might be getting in the way. I call them fertility barriers, where there's something that maybe isn't like, oftentimes it isn't just you're infertile. There's something that's completely shutting it down. It's more of, oh, there's some little like roadblocks along the way where if your body is having to, in a sense, jump over all these different roadblocks, then it's really slowing down the process and maybe getting to the point where it's just not working at all. So again, we're looking through that lens of like, let's tease things apart and really see what could some possible roadblocks be and what information do we need to get to really identify more. So typically we are doing more comprehensive testing than what's typically
Mhm.
being done. Again,
Yeah,
some of them they're the same markers, but looking through the optimal lens, testing more markers to really get a sense of, inflammation and nutrient levels and things like
sure.
that. Oftentimes we're doing what we call functional testing, which is
Mhm.
really looking even deeper than routine blood testing. So that might include stool testing to look at the gut microbiome, even like vaginal microbiome testing.
Mhm.
I like to do organic acid testing, which is basically looking at how pathways are running in our body. So we can really get a strong sense of, okay, yeah, here's what's working really well in your body. Here's what's not working so well. And here's what we can do to optimize it. So we're getting very targeted in, what we're wanting to address. And of course, we're talking about the basics too, making sure that we're moving well and we're eating well. But we can also tailor things to each unique individual because we are all unique and we have different barriers. So being able to really tailor it to each person.
That sounds so wonderful. So, when a patient comes to see you for functional medicine for fertility support, are they generally coming in? I mean, of course, I know ideally we all want everyone to come in for preconception care, but I'm just curious how your practice is in terms of the type of patients that are typically being seen. Are they kind of more natural fertility? Are they coming in for support during an IVF cycle or some type of ART treatment?
It's a variety, actually. So I do have people coming in for preconception, which I love. Like you said, it's such a
Yes.
nice opportunity. And I think there are more and more people who are aware of their fertility. So I do
Sure.
have a great population of those people. Um, for fertility, I would say it's probably a little bit more predominant with natural fertility,
Mhm.
trying to get pregnant naturally. Either they're still fairly early on in their
Mhm.
experience and just wanting some more support. Maybe they're in that first year and their conventional doctor is like, okay, we have to wait a year until you're considered, having infertility. And they're not satisfied with that. So they're coming in before that. I
Right.
also have a lot of patients who are much farther on down the road where they've been trying for many years. Maybe they
Mhm.
have or haven't done ART. I have several patients who quote unquote failed IVF where
Right.
either, they were told their egg quality wasn't good or their embryos weren't growing out or they, tried to transfer these embryos and they kept not sticking. Or I have a lot of patients too who have recurrent pregnancy loss,
Mhm.
either
Those are
natural
such
or
yeah, such tough
artificial.
cases,
Yeah.
really. And I think they hit a point, these women, where I think they just need a break
Yes.
from all of those types of treatments. And so what a great way to be able to take a pause and still work on your overall health and well-being, your
Mhm.
mind, body, and spirit, while you're taking a break and whether you're going to continue down the road of IVF or not, it's nice for patients to have an option besides ART. So thank you
Yeah.
for providing that care. I think it's huge. So in the space of supporting women through natural fertility, is there a component of your practice where you're prescribing bioidentical hormone therapy as well?
Yeah, absolutely. Yeah. I'm so lucky. I'm glad that I have the ability to do that.
Yes.
And really be able to support women with that when they need it. So like
Hmm.
progesterone, for example, would be, the one we're using most often.
Hmm.
Ideally, again, we're supporting their natural progesterone secretion and getting their progesterone levels up, without even having to use replacement. But it is really nice to have that option of, especially if they have had recurrent pregnancy loss,
Right.
even if it's just we feel a little better with it on, sometimes that is a really valid reason to have it as
Totally.
a
Yes.
blanket of like, okay,
Right.
just in case progesterone was the issue in the past,
Right. Right.
being able to use that as part when we're.
And if they're coming from sort of that ART world, they're kind of used to that protocol. So I think that, like you said, it gives the peace of mind to
Mhm.
know, like, okay, just in case I've had a history of luteal phase issues and low progesterone. So, but being able to offer something like bioidentical form of progesterone is so great.
Yeah.
And I know that you and I have co-treated quite a bit, and I love sending patients to you for that extra support. So thank you for providing that because I feel like sometimes it's a push to get that extra support. Sometimes patients have a hard time getting a progesterone prescription from their OBGYN for whatever reason. I'm not sure why, but there's sometimes a pushback on it, especially when a patient's trying naturally.
Yeah. Yeah, it is so silly to me, honestly, because yes, there can be risks that come with so many different things, but we prescribe some things so easily and some things
Sure.
we're afraid of it. It's like progesterone is not going to be the thing to, harm someone typically,
Mhm.
especially if it's in, a reasonable dose and they're
Right, right.
treated well about it. So yeah, so I definitely am encouraging of people to use it, especially if there are signs that maybe they need it.
Yes. Well, so going back to your case, I'm just wondering when you have patients that are similar to your situation where they have amenorrhea post getting off of birth control maybe and they're ready to start trying but they're not able to get back online with the period. I've noticed that there's a trend in patients being diagnosed with PCOS. That
Mhm.
seems to be kind of like the most common diagnosis that I see, but oftentimes it may not be the case that they have PCOS. So I'm sure you've seen this quite a bit.
Yes. Yeah. And I'm actually so glad you brought that up because that is something that I've seen a lot too. And I
Mhm.
experienced that also. And looking back, it's like, oh, interesting that, the thing that I see that is causing that, or like my suspicion of why people are getting that PCOS diagnosis so often is because if they're getting an ultrasound done and they have cystic ovaries,
Sure.
regardless of what their other lab work looks like, they're
Right.
getting a diagnosis, or at least sort of a vague diagnosis of
Right.
you
Right.
probably have hormonal.
Possible PCOS.
Yeah, or like a mix of things. And
Hmm.
it's a little bit frustrating to me because I do think it is confusing. If someone doesn't fit the picture in any other way, getting the PCOS diagnosis can really derail what you're doing and confuse the picture much more. In again, looking back, I'm like, oh my gosh, of course, your ovaries become polycystic when you're not ovulating because they're just sort of
Right.
building up. You need them
Totally.
having like a regular
Yes.
cycle to, for one, inhibit some of the follicles from growing, but then also to, get one primary follicle to grow and rupture, which is ovulation.
Hmm.
So it's very, very common to have multiple, cysts, sometimes they'll call it, or, follicles showing up on ultrasound when you're
Hmm.
not having ovulation. And once you do, then they go away. So it's sort of like, yeah, that shouldn't even really be part of the picture. It really should be based off of more of the hormone levels. And sometimes it
Hmm.
isn't black and white. I'm seeing
Right.
people,
Right.
it is often where I'm like, you really seem to fit the PCOS picture. It might not be 100% consistent with the diagnostic criteria, but based on their symptoms, if they're having insulin resistance, if they're having irregular or long cycles, then usually
Hmm.
we are saying, it does look like this is maybe part of the picture.
Sure.
So that we're approaching it not just from like a here's your diagnosis
Yes.
point, but
Right.
more of, okay, well, here, this is what we know about PCOS and how we can approach it then from the root cause. So I feel like I don't know, that's where I like to approach it from.
That makes so much sense. And being able to just kind of say, okay, well, it is potentially PCOS, but as your period and your cycle gets a little bit more on track, it will sort of unveil itself a little bit more.
Mhm.
And hopefully we'll know more about your condition. But yeah, I feel like Western medicine, unfortunately, there's And patients are looking for it too. It's not, I don't want to say it's just the physicians that are diagnosing, but I think patients come in going, I think I have PCOS, and they're like, I'm not having my period. I have acne, and other symptoms that can be associated with PCOS. So what about in the case of hypothalamic amenorrhea, which is the other condition that is related to anovulation
Mhm.
and irregular menstrual cycles? Yeah, how do you distinguish between the two?
Yeah, so hypothalamic amenorrhea technically is not just like you're not just not having a period. And of course, there's, not to get too far into it, but there's primary and secondary amenorrhea, meaning primary is you never got a period.
Hmm.
Secondary is you somehow lost your period at some point. With hypothalamic amenorrhea, it's sort of a special type that is, basically in response to a stress on your body. You lost your period. And the way I talk to people about this and describe this is sort of like it's like our safety mechanism of if something too crazy is going on around us, there is war or famine, or it's not the right time to have a baby. Our body has become really smart to shut down our reproduction. It's like this is not a good time. And that's a great safety mechanism. Back in the day when we were,
Right.
our ancestors had a lot harder life than us, that was very good to cut that off at that time. Now we have a lot more stress that maybe isn't, war or famine, but we're just really stressed out with work, or we're exercising a little bit too much.
Hmm.
And that is, that same pathway that's cutting off our period, our
Hmm.
reproduction. And so it's, with that same thing in mind, then that's how we approach it from the other side too, of like, okay, we need to slow things down. We need to
Yes.
nourish our body. Sometimes we
Right.
to really, change the way that we're using our body, like, exercising and really slowing down rather than doing more and more and more to fix our health, which people are usually really, we feel like no pain, no gain. We want to like
Sure.
do
That's
more.
very much in our culture, isn't it? Yeah.
It's really the unwinding of that,
Hmm.
really slowing down, learning to listen to our body, really nourishing. And I also kind of like describe it as a pendulum. Like if we've swung the pendulum one way, where our body is like, nope, we are in survival mode now. Whatever it is that was triggering that, we need to swing the pendulum the other way and go, okay, we need to give your body all the signals that is safe. And maybe it feels uncomfortable on the other side of things, like not exercising at all, eating way more than you want to.
Hmm.
It
Hmm.
that can feel really scary, especially to women who have developed hypothalamic amenorrhea. They tend to be type A, maybe perfectionistic, really high achievers. Like they're maybe very successful and have had a lot of positive reinforcement of these types of, behaviors. It can be really uncomfortable to go the other way, but that's typically what's necessary to then again get that safety signal to their body and then be able to get things back on track.
I love that explanation. I feel like there's a common theme no matter what imbalances are going on for you, you know, in your health in general. This is good advice to just unwind, slow down, reduce your stress, decrease your cortisol levels, and really get out of that fight or flight mode.
Yeah.
And
Yeah.
yeah.
While there are so many things that we can do to benefit our health, I really, especially with my own personal experience, my professional experience at this point, I'm like, wow, it's really the undoing that has the most
Mhm.
impact in our health. The, de-stressing, the slowing down, that's really where the most important and transformational power, I think, comes from with our well-being.
Amazing advice. Well, so speaking of advice or wisdom that you can share, is there anything that you would want to share to women that are trying to conceive and looking to start a family? Any
Yeah.
words of wisdom or advice that you think would be helpful for these patients?
Definitely. Well, starting early is never a bad idea. So, like we were talking about preconception, really looking at your health before you're even trying, if you have that opportunity, is so incredible because you really can, you know, go deeper to look at your health and really make sure, for one, that things are in good order to get pregnant, at least, to the best of your ability. There's no crystal ball, but really, seeing that things are in good line, but also being able to really like replenish your body before you have a baby. Thinking about like building up all the ingredients, so to speak, that it takes to create a baby. It's going to support your experience throughout pregnancy. It's also going to support your baby's health.
Hmm.
So, and this also goes along with like our DNA health, really undoing some of the damage from all the things we've been exposed to. It's a really an awesome opportunity to support your health before even trying, especially if you're in your 30s or beyond.
Hmm.
If you're already trying and you're like, okay, well, that ship has sailed, I'm already in it and maybe
Yes.
struggling. Again, maybe not waiting around if it doesn't feel right to you, not waiting that, 6 months if you're over 35 or a year if you're under that to get the diagnosis of infertility and then be able to get some testing. Usually that's really frustrating. And once you even get the testing, it's still pretty sparse in what they're looking at. So really not waiting around to support your health, do all the things of, eat well, move your body, all those foundational basics are so important. But then it doesn't hurt to also work with someone to also get a little bit more detail. Working with an acupuncturist, especially if you're stressed, starting to nurture yourself from that standpoint, especially if you have other health concerns, maybe talking with a doctor, a functional medicine doctor, to go deeper. It oftentimes can make the journey just feel a lot more supportive, but then also can really save a lot of time and stress with guessing.
For
Uh,
sure.
so yeah, it's my biggest piece of
Great
advice.
advice. Thank you for that. And what about for women that may be going through the transition of perimenopause and menopause?
Mhm.
It
Yeah,
sounds like you see quite a few of those women, and I'm sure in your practice, if you're working with women that maybe are starting a family a little bit later, that, perimenopause is kind of around the corner after they have their child. So, and I see that quite a bit too, especially for women that are maybe like in their early 40s. And so they have one beautiful baby, and then, they come back for postpartum care. And then they're also saying my hormones are not the same. Like I'm just feeling completely different. So,
I
yeah.
agree. Agree.
Yes.
Yeah, yeah. I mean, I love talking about perimenopause and I love that it's a lot more commonly talked about, on
Hmm.
social media and all of that too now, because it is an experience that, like you said, is a transition and it can be a long transition between regular cycles and then not having a cycle at all of menopause. And it can be a wild ride. Our hormones really go wild before they settle down. It's sort of like puberty all over again, basically. So women will
Yes.
joke that they're like going through puberty with their teenagers because they tend to line
Hmm.
up. Um,
Right.
and
Unfortunately, that timing
yeah,
does line up.
unfortunately, the timing is sort of a
Hmm.
cruel joke. But in reality, I think my biggest piece of advice would be to get support on the journey because so many women look back and they're like, oh my gosh, I was just suffering for years
Hmm.
unnecessarily. And so I think, if you have any suspicion of that, oh, I think maybe this could be perimenopause, or even if it's not, if you're like having terrible PMS, my hormones feel like they're all over the place, my mood is wild, or, maybe your periods are a lot heavier or lighter or more
Hmm.
irregular, working with someone to get the right support and even just get the education of, yeah, this is what's going on in your body. Oftentimes that like there actually are tools that we can use to make the experience better. It doesn't mean you're not going to go through it. We can't not go through.
Yes, but why suffer?
Oh, why suffer?
Why make it
Yeah.
so hard on yourself? I'm on the other end of it now, I think.
Mhm.
I'll call myself perimenopausal. So I know firsthand that, and the way you said it's a wild ride hormonally, oh yes, for sure. And I think being able to have the knowledge and the data, like what is my hormonal status and what are some of the tools that can kind of soften some of the symptoms because they're tough. They're really hard. And so many times I feel like you compared it to puberty, but I think of it a lot like postpartum. In our postpartum phase, our hormones are kind of all over the place too. We're not sleeping well, just like in perimenopause and menopause.
Mhm.
But when we have a baby, it's different because we have this beautiful baby to be like, oh, it's all worth it. But when you're going through perimenopause and menopause, you don't have this amazing like reward. You're just like, I just don't feel good and I'm not sleeping. And so I would love to hear what are some of the things that functional medicine can provide for these women to help with the transition.
Yeah. Yeah. So for one, again, making sure that the foundations are really solid. So
Hmm.
during that time, a lot of women have the experience of like, my body is not my own anymore. All of a sudden, like I'm eating the same way I always ate, I'm exercising the
Hmm.
same way that I always exercised, and now it isn't working for me. They're gaining weight, or they're feeling off in any way. So working on the foundations from the standpoint of, okay, here's where you are now, to the best of our ability, saying, okay, this is probably what's best for you now. Here's what's best going into the future. Again, kind of preparing them of this is what it typically looks like through the
Sure.
perimenopause transition, what menopause, what comes up in menopause. And so really kind of restructuring their foundations again is, very first and foremost in my mind. Also, again, the basics of making sure their vitamin D is good, their iron is, levels are good, all like that their body is able to function optimally. And then beyond that, be able to use things like herbs and certain supplements, nutraceuticals to be able to support their body even further. Maybe their estrogen is really high. Okay, let's give some support to help get rid of those estrogen metabolites and help, detox that, for example. And then beyond that, using things too that are a little bit more direct with their hormones, especially later on in perimenopause. That's where we might get a little bit more aggressive isn't the best word. It's not really aggressive, but more direct with, okay, maybe we
Mhm.
do to use bioidentical hormone replacement to really help, give them progesterone back. 'Cause it's one of the first things that happens is you're not ovulating or not ovulating as regularly.
Sure.
Progesterone is really low or
Right.
not present compared to estrogen. So maybe giving some progesterone support, maybe giving estrogen and progesterone support, maybe testosterone also
Mhm.
to really again ease that transition, help them feel their best, and also prevent risk factors that come up later on down the road in menopause too, especially if they're going through that experience on the earlier side. Then mitigating risk is another big thing that comes with hormone replacement too.
Right. Well, I think that's all amazing options for women because I think every woman has different history, obviously, and background in terms of cancers in their family. And I'm sure you experience this too, where certain patients are open to bioidenticals, whereas other patients are like, I just want to really look at nutraceuticals and diet and lifestyle. So it sounds like your approach is comprehensive and varying where patients can really have a customized approach to their care. So that's super cool. I love that.
So important, right? Because yeah, we do all have different stories, and sometimes we're afraid of things unnecessarily. Like we've been told that we can't do hormone replacement because it would increase our risk. And we're like, oh, actually, based on your history, based on everything, as long as we're doing it in a really safe way, we're monitoring the dose, we're keeping doses in a physiological level, meaning within the range that your estrogen, for example, would normally be in, then sometimes the risk actually isn't even any higher. The risk of other
Mhm.
things could be lower. And so, yeah, we're always having a really informed conversation about here are all your options. Here's what we could do. Here's sort of a stepwise approach of how we go through them, so that it is really tailored to each person.
Well, what always impresses me about functional medicine doctors is that the the testing process, right, and keeping an eye on the levels, the monitoring is so much better. I've had patients come to me and say, "Oh, I've been on hormone HRTs, but I never get my labs done. I didn't even have my baseline
Mhm.
hormone levels drawn, and my eyes just get really big, and I'm sure my jaw drops too." And I'm like, "Oh, and so,
That's
yes.
also having a risk. I know I've had so many patients come to me like
Hmm.
that where they're like, I'm not feeling well, and their estrogen is super high or their testosterone is
Sure.
like,
And
oh,
their dose is static. It's been the same for like 2 years or something like that. And, there's no monitoring going on. So it's so great to hear that you pay such close attention to their levels. And I think that's key because again, everything fluctuates for us women.
mhm,
Never
yeah.
a dull moment in our body, right? Yes. So how can everybody get a hold of you, Dr. Naylor? Is Instagram one of the best places? I know you have your own podcast too
Yeah,
that
yeah.
you
So I
just
just launched my
started.
own podcast, Modern Women's Wellness. So you can
Exciting.
find that wherever you like to consume your podcast. So Apple, Spotify. Um, I have a website, Dr. Miranda Naylor. So that's a great sorry, drmirandanailer.com. So that's a great place to learn more and to like schedule a clarity call. And I'm also on Instagram, of course, at Dr. Miranda Naylor. And I love to share information and try to just put more education out there that's really appropriate education for
Awesome.
women.
You have great education through Instagram. Amazing. I'm just always so impressed by your Instagram posts and I know you're on YouTube as well.
Yeah, YouTube as well for
Okay.
especially for like the podcast videos and everything. Yeah.
Nice. Any upcoming events that you'd like to share about?
No upcoming events right now. I'll probably have something down the line later spring or summer. We're gonna have a local event, but nothing set quite yet.
Okay, great. And did I see on your website that you have a fertility program also?
Yeah, so yeah, I do have a fertility program and building out the women's hormone one as well. It's just a 6 month program, basically just streamlining things so that taking the guesswork basically out of what we're doing and really just being able to move women, move couples through our strategic protocol so that they can
Love
really,
that.
yeah, get the results they're looking for.
Are these usually like group programs?
So they're one-on-one. We do have, I've had group programs before and we'll probably build them back out again to be able to offer those. But right now we're focusing really on the one-on-one, as well as, having the opportunity to have, health coaching if people want that.
Hmm.
Um, just again, helping them feel just super supported throughout the process.
Amazing. I love that. I will share all your contact information in the show notes.
Awesome, thanks.
Thank you so much, Dr. Naylor, for being on my podcast. And, I really appreciate you sharing your story. And I think so many women are going to learn so much from that and being able to just navigate their own journey through life. We just, as women, we have so many things going on already. And, our hormones being, another thing that is so up and down that can have such an impact on our lives. So I think having resources like yourself and experts in the field to be able to support us through all phases of life are so important. So thank you for the work that you do.
No problem.
And yes, I look forward to continuing to co-treat with you and sending lots of patients your way. I'm excited about your upcoming programs too, so keep me in the loop for sure.
Wonderful.
All right, awesome. Thanks again.